We are now recording. So now we could say, hey guys,
Okay.
hope all is well. Hope y'all enjoyed your break. Hope y'all are ready to get started. We will keep this short and sweet. Obviously, we can answer questions for you guys. Do y'all want to just talk about term 3 now and worry about term 4 later? Do y'all want to do it all now? It's up to y'all. Throw it in the chat, opinions, all of it. Okay, yep, that's fine. We could do that. Yeah, sure. Yeah, we could talk about, well, we have a mix of opinions.
We'll give you some tidbits because I firmly believe that year 2 is very different from how you approach year 1. And so it kind of blends.
So we'll do all of it, and it'll be recorded. So
yeah.
But my advice is, like, as of right now, don't even worry about term 4. Like, just focus on tomorrow and get term 3 done, and then you can worry about it. But we'll talk about it just so y'all have a heads up of what to expect. Lindsey, the floor is yours.
Okay, so if you guys have specific questions, of course you can put them in the chat and we'll get to it. But I guess I'm gonna piggyback off of what I just said, is that year 2, I believe, is a lot different from year 1. And SGU really does have a method to their madness, and you don't really realize it until you get to this point. And the method is, you have all of these building blocks and these puzzle pieces, and you put them together over time. And like throughout 3 and 4, I had so many aha moments because of the foundation that was set in year 1. And so a lot of stuff in year 1 felt out of place, or felt like you weren't given a lot, like you were only given a taste of what it was, and you were, but you've had all of this time for your brain to kind of sit and process it and sit on it. So when you comes back and you apply it to the big picture in year 2, it starts making a lot more sense than it even did in the first place. And so SGU does have a method for their madness. They're really just giving you more puzzle pieces and more puzzle pieces to put into your big puzzle. But the biggest thing, which you're going to notice very quickly, is 3-4, the lectures are very organized into chunks, which I love because I love chunking the information. So it's very good at giving you, okay, this topic, this topic, this topic. And so that helps me a lot in organizing and kind of mentally sorting through the information, because I was able to break down, okay, this is what I'm working on now. This is what I'm working on now. This is what I'm working on now. Like, for example, I don't know where my binder is, but for the midterm, you'll have stats, some micro, some immuno. And you keep going with that theme of, okay, this is all chunked together. This is all chunked together. This is all chunked together. But Brady, do you want to put anything in right now?
Sure, yeah. Okay, so I'll be candid with you guys. Term 3 has been my worst term so far. Term 4 was my best. So I know people say the opposite. I guess it depends who you talk to. So
I would say, I would agree with that statement. Term 3 is worse. And the reason being is you can't underestimate this information. And I know you've probably all heard this, and we're going to say it today. Ethics is not what you expect. You're going to go through, that's on the final. You're going to go through ethics and you're going to think to yourself, oh, this makes sense. Oh, this is pretty intuitive. It's not. It's just not. Just accept it, move on, study it, do your very best. But even those of you who think you're going to do well, like all of us thought we were going to do really well in ethics, and it's just, you're not. So just accept that right now and emotionally prepare yourself to get some curveballs when it comes to ethics.
Yeah, like there was a girl the term before us that would majored in medical ethics. She was on the board with the IEA board previously, and she did, ethics has been her worst subject at SGU so far. So like, I went into it thinking it would be intuitive. It's not. People said do practice questions, but I also heard that SGU teaches some of the ethics a little differently than the boards does. So I didn't even do pre-tests and board style questions for it. I just went into it thinking I'd be able to figure it out, and it just didn't. It wasn't like that. And yeah, so let's just start from the beginning. So you're going to start with bioethics, and there was one thing I wanted to point out. I'll share my screen so I could show you guys. This is so stats is not exactly fun, in my opinion. I don't consider it very clinically relevant. That's just my opinion. But so I didn't particularly like it, but what I want to point out is this, that a lot of the math does get complicated in the stats. But if you look at this old IMCQ we had, well, here we go. Oh, this is patient safety. Shoot, hold on. If you look at this old IMCQ from the biostat stuff, the biostats is going to be theoretical stats. So whereas you'll learn a lot of equations and stuff like that, maybe it has to do with the fact that we're still technically in the online format, and there's not, you can't use scratch paper at the moment, but the questions tend to be in this style, this vignette style. So what I found was with the biostat stuff, the material that was tested tended to be in earlier part of the lecture. It almost seemed like towards the end of the lectures, it's like they ran out of time and they went like exponentially more difficult. And it was like, I don't even know what you're talking about with these crazy equations. But then when it came to the IMCQs, they broke it down into some of the more easier aspects. Like,
be able to explain the concepts. It's going to be a little more vignette and explanatory than it is, here's a bunch of numbers, give me the result of that. So just what Brady is showing here, you need to be able to interpret what's going on and be able to explain what's going on instead of having the values and all of that stuff. I'm going to answer a question in the chat about the curves. Remember, an exam is only curved if the entire class average is significantly below the whatever was calibrated for that exam. If I remember correctly, we did not get a curve on either the midterm or the final exam for term 3. And so it really depends on your class performance. I will say, I think our class performance was slightly lower, but it wasn't so low that we got curves for it. So
right. So no, I don't think we did. So in regards to the biostats, if you didn't take a bunch of stats classes in college and stuff, don't stress. This is medical stats. You're looking at research stuff, confidence intervals, p-values. We're still going to do reviews for you guys. I'll be on the island in like 10 days for whoever's there. So we'll do that.
Over there at the
we'll do
end
it.
of July.
So, and I know a lot of people are on a accredited tour right now. But,
is anybody on the island right now? Do your little raise hand thing if you're on the island currently.
A lot of them are still on the tour. They went on a whole like waterfall tour today, so they were supposed to make it back. Anyway, yeah. So okay, back to So in regards to the stats, just keep in mind you don't have to spit out a bunch of equations or be able to do a lot of the math. It's more theoretical, right? You want to be able to just kind of be able to comprehend and understand. So if you're looking for explanations of how the test is going to be, look at the IMCQs and see how they do that. Again, typically it was like that first part in lecture when they started talking about the p-values, the equations and stuff. But once they got to the end, it was like just really out there. Y'all are going to get into testing like false negative, false positive, all that stuff, specificity, sensitivity. That's always important because that's how you diagnose patients typically. screening tests and confirmatory tests. So that's going to be important. So as for the teaching style, yeah, give or take, it was a little, I don't know. Stats is just a different beast in itself, right? So take
I
it or
really
leave it.
enjoyed the teaching style, but that was me. I really enjoyed how it was very straightforward. I felt it was very straightforward, explanatory, but I will say this. I relied heavily on to understand biostats better. I used osmosis. I felt that gave me a really good, more conceptual understanding, because I felt like the lectures are really good at just honing down the actual topic, what that you wanted to know, but I didn't understand it conceptually. And I like to understand something conceptually to put all the pieces together. And I felt like there were a few things in biostats that I wanted to understand better. And osmosis really helped with that. There are probably other supplemental resources that do that as well. But I did rely heavily on that to understand it.
Okay, so that's the stats. Just trudge through it. That'll be through the first midterm. You're also going to do before the midterm. Hold on.
Micro.
Oh yeah, but wait, hold on. There was you do the not bioethics, the population. Oh,
yeah, it was
like patient safety and stuff like that. So y'all will get into that a little bit too. Where the stats ends before the midterm, the ethics picks up for the final. So try to do well on the first test. So there's only 2 tests, right?
Yeah.
So fortunately, term 3 isn't worth a lot of credit on your overall WMPG.
Yeah, it's 8 credits.
Yeah, health systems, that's what it is. Yeah. So you do need to, you're going to learn about like Medicare and Medicaid and like, you know, unfortunately you have to know that as a physician. So you get into the different.
It wasn't bad though.
Yeah,
I
no,
didn't
that's
think
not
it was
bad.
very bad. It wasn't bad.
You get into the payment schemes versus hospital payments versus insurance payments. That's fairly straightforward. I think, you know, for the most part, the hardest thing about the first test would be the stats. But try to do good on that, because I'm telling you, when you get to the ethics towards the final, it's give or take. And I'll give you a perfect example. Like I remember a couple of questions. Like one was about asking about ICUs, and like the patient wanted her family, like it was some sort of religious ceremony, wanted their priest for their specific culture to go into the ICU to be able to do it. Now, I've been to ICUs where they don't let patients, families in. There's ICUs that have visiting hours just for family. There's priests that circulate around through the hospital that go to ICUs. And the question had every different scenario. And I was like, it kind of depends. And like, so I firmly believe I could justify a lot of my answers on the ethics stuff, and then come to find out, you know, I was wrong.
I think the best piece of advice on ethics is learn what they want you to learn. Yeah, knowing full well that real world application is going to be different. And a lot of times it's going to be different simply because of the system you're working in, because of the rules, regulations, the laws in that state, county, whatever. It's going to change. So don't go into it with, you kind of have to separate yourself from what they're teaching you with ethics, because you're going to have your own thoughts, beliefs, opinions. Everybody comes from a different background. Everybody comes from a different bias, depending on if you've worked in the medical field, if you haven't worked in the medical field, what you've witnessed. And so some of these things, like Brady said, you're going to be able to reason with a lot of these answer choices. But what you need to do is separate yourself from all of that, look at it very one-dimensionally and say, okay, what are they teaching me to focus in on this question? Now, a lot of it's going to be kind of up in the air, but if you keep that mindset through the ethics, that's the best piece of advice I can give you to answer those questions.
So tagging on to that, even though there are slight differences in some areas where SGU will teach versus the boards, I would just go ahead and do practice questions, because honestly, if I could change anything about my term 3, I probably would have done practice questions and not like banked on the idea, well, SGU teaches it differently, I'll figure it out. So just try to do some practice questions. But that's going to be towards the end, towards the final. I'll give y'all another example. So they said, there was a question, they said 2 doctors were on an elevator. And, you know, obviously patient confidentiality with HIPAA, you're not supposed to talk about it. One doctor told the other doctor, did you get the chest x-ray ordered for the patient in room 230 or whatever? And then it was like, what should you do? And like, one of the answers was like, as the other doctor, what you should say, we can't talk about it right now, or like the med student ordered it, or like we're going to order it. And I swear I sat there for 10 minutes. I was like, how many people were in the room? Because is he by himself? Because then you're kind of saying that the guy in that room needed a chest x-ray. And I was like, can you say the med student ordered it? Or can you even say that in the elevator with other people? I mean, like, it was really convoluted and it was not a fair question. And that's kind of how ethics went. So it was, you know, just not the greatest experience. Anyway, y'all
Know
can worry
the
about
criteria. There are certain things about ethics that have certain very specific criteria. Know the criteria, and then definitions. So some terms will be under like one umbrella and some terms will be under another umbrella. And the question will be asking you about a very specific umbrella. But the you know, there are multiple answer choices, so you can actually eliminate two, maybe 3 answer choices if you know what they're talking about. And so there are some buzzwords that you can use, and you know, we'll talk about that in our reviews, but definitely pay attention to where things fit in like the overall scheme of things, because that can help you narrow some answer choices down.
Yeah, so I did all the Sakai questions. I mean, like, do outside questions as well, just to get used to the format. It's just not, it's not your classic like symptomology type, you know, you're testing for what's the best answer for treatment, you know, so it's just different. Yeah, we're going to do reviews back on the island. I think the plan is we're going to do them live for the people that are there, but stream them at the same time for people that aren't. So we'll figure that out when we do it. Anyway, so what else? So the micro is very introductory. A lot of that you're going to have touched on in undergrad. They're going to teach you about the augers, you know, the basic principles of gram positive, gram negative. You'll talk about briefly some of the more popular, not popular, but the more common bugs and viruses, some of the virulence factors that go into how they work. It's very introductory. You should be fine with that. Some straight memorization, just kind of like you got to use this auger to grow this type of bacteria and this stuff. So I think y'all will be fine with the micro. The only thing I really didn't like, it took a little bit, is a lot of the parasites are just ridiculously difficult to comprehend, like to verbalize. So
don't underestimate that stuff, because I spent so much time going through that and it still like messed me up on the exam. So that was definitely the hardest part of micro.
Yeah, they're hard to pronounce. Some of them you haven't heard of, but the whole point is that the micro is introducing you to term 4, because when you do a lot of the pathology in term 4, you're going to talk about certain bugs that affect the heart versus the GI tract, stuff like that. The other component that you're going to touch on, Dr. Ramos, thick accent. She teaches immunology. She's from Cuba. And she's a great teacher. It's just she talks
fantastic.
fast. She talks fast. The problem, if I could verbalize the problem in immunology, it almost seemed like you were reading every other page of a book. Like it didn't. It wasn't a clear thought process throughout, because they're teaching you little components, and immunology is very complicated, and you get into the organ systems in term 4 and it makes more sense. But as for term 3, it's like they touch on it and you want to get more information to understand it, and then they jump to a different topic.
Yeah,
so
that
you kind of just have to take each lecture as you go and just take it as its own entity, right? You're going to learn, you know, a couple of points on
very good at pointing out what you need to know, though. She's extremely good at honing in on, this is something you should look at. She did these review things for us. I think it was like the end of the lecture right before the exam. She would have these PowerPoints where she goes through and it basically shows you what she's thinking. It shows you what she thinks is important. I thought they were incredible. Like they were Jeopardy style. It was like a Jeopardy style thing where she went through and you're like, oh, that's what she wants you to know. Oh, that's what she wants you to know, because the lectures are very, very dense. Like Brady said, they kind of touch on a topic and then they move on. They touch on a topic and they move on. And it'll repeat itself over and over again. And it'll talk about multiple things in multiple places. But if you recognize what she's actually thinking, it's really good to go back through those lectures and say, okay, this is what she likes. This is what she likes. This is what she likes. Yeah.
Yeah, like her IMCQs are very representative for immunology of what the test is going to be like. Back to micro quickly. Dr. Harrington's a really good teacher as well. She likes the virulence factors. Like she'll do second and third order questions, give you a scenario. You need to know the bug and then be able to tell you a little bit more about it. So it does get a little
underestimate the type of it. So if you're talking about a gram-positive motile facultative anaerobe, you better know that that bacteria is a gram-negative motile facultative anaerobe. Like sometimes and this is what kind of tripped me up on term 3 and in term 4. Maybe this was more in term 4. I don't really remember. They'll go through the entire presentation and you'll know exactly what it's talking about. And then they'll say, which of the following is representative of the causal agent? And it'll be, single-stranded positive sense RNA, gram-negative motile rod. And it won't be what you thought was important in there. And you'll know the name of the organism, but don't underestimate those things because it will come and bite you.
For sure. So that's that. So yeah, and then obviously you'll carry micro and immunology over to the final, but you'll replace stats with ethics. So, to test, there's no really a lot of room for makeup. You got to.
Yeah, there's not. And the soft points are very few in term 3. Very few in term 3. And so the exams, there's not a big cushion there's never a big cushion per se, but just know that that's where your grade begins and ends with the midterm and with the final.
And that being said, like I mentioned before, term 3 doesn't count for a lot just because the time frame towards your WMPG. So don't stress too much about that. That's all I really had for term 3. Yeah, so if y'all want to discuss.
Oh, and so the biggest thing you probably have all heard, the number of small groups goes up exponentially a lot. And so just prepare yourself for that. You are going to have a lecture and something almost every single day. In term 3, you might have one, maybe 2 days if you're lucky in a week that you only have lecture. But honestly, like prepare for your time commitment and actual activities to increase. And then in term 4, you are doing multiple things every single day. And every once in a while, you'll have a day off where you only have lecture, but just mentally prepare yourself for that.
Yeah, so term 4 has 55 small groups. Yeah. That's how it works. It is pretty much every day.
Sometimes you have IMCQ and small group and lecture in one day.
Now, as it should be noted that term 4, there's a lot that can be gained from the small groups, right?
Yes.
So like you have to present pathology similar to the histo in term 1, but your group can organize it beforehand and you have to write a multiple choice question and then present it. I actually found that quite helpful. Whatever you present on, it doesn't take that long. You just write a question and present it. If you do that, you tend to remember it. So there is a lot to be learned doing that.
And the pathology small groups, you are expected to break them up. So how in year 1, you're you're told you need to prepare the entire thing. That's not the case in term 4. You are actually expected to break up everything, and so one person will have one slide, and so you do your vignette, you do your explanation, and you move on. So there's different types. Of course, you have pharmacology small groups, you have micro small groups, which I actually thought those were very helpful because they actually walk you through the process of differential diagnosis, narrowing it down to, okay, how are we working through this case? I actually, if you get a really good facilitator, like those are actually, I really enjoyed those small groups. You have the pharmacology ones, which can get a little tedious just because it's a lot of information, and pharm tends to be a problem area for a lot of people. And then you will have the clinical skills ones, where you will, in the term 4 is when you get all into the clinical skills fun. You will do work as a group to interview a patient. And so you get into that. Those, if you are past scribes, you will have a little bit of a leg up because you're going to have to start writing SOAP notes. You're going to be writing HPIs and everything like that. So if you're past scribes, like people find those friends, because I did a couple sessions with my small group and my friends of, this is how you can get good, because writing HPIs and having to do it in the time frame that they give you is actually very hard and to get used to, and to, how do I want to phrase this and everything. And so find those people, practice it. The actual mini OSEXs that you do with your group, they're not worth that many points. And there were some small groups that I heard winged it, and they didn't care because it was only worth 7 points. But I would very strongly recommend that you guys prep for these things, because when it comes time for the big OSEX, you already have down how you're going to do it. So I already knew how I was going to interview the patient, and it's not as intuitive as you might think it is. And then I already knew how I was going to do the physical exam. And, if you're doing it online, you have to verbalize the physical exam. And so if you practice it, and if you actually do, decide I'm going to take these group OSEXs seriously, then you set yourself up for success when you are studying for your last content exam and the OSEX at the same time, because that did get a little tedious. But I think Brady would say the same thing. I enjoy term 2. I think, you start feeling like a medical student because you're diagnosing patients, you're looking at the pathology. And so it gets a lot more applicable, I would say. And it's very, very organized. For each system in term 4, you have the pathology, you have the pharmacology, and you have the microbiology. That's it. And it's very, very organized. It's laid out in kind of the same format. I put all of the same lectures together. And so those of you who are a little type A, like me, like to chunk things, like to organize things, it'll be very good for you. You're going to enjoy how it's organized and how it's set up.
Right. So just to reiterate that, take the small groups that you do in regards to writing the SOAP notes, the patient notes, take advantage of that. You really got to work diligently with your small group to split things up. Be transparent with them, get it done. But by the time you get to the OSEX, like it's all a team effort until the final OSEX is what we literally just took, where you are alone with a mock patient and a doctor's grading you. You have to take the history, interview the patient, verbalize the physical exam, diagnose the patient, put the plan together, order the labs that you need, and write the note and counsel the patient if there's anything to be counseled about, all in 28 minutes. Okay, so it comes quick towards the end. It is rough. It is stressful. I was like, I don't know, I'll be fine. And then I was stressed. It stresses you out because I was like, I'll have extra time. I'll like proofread it. Like, no, like it's just very fast. So take that time to practice when you do the SOAP notes, to do that, because it does catch up on you. It's fast. I swear the time goes so fast. Other than that, so let's get into term 4 a bit. Now, term 4 is very much foundation driven on year 1. So the stronger foundation you have on normal anatomy, the easier the pathology is going to be. The less you have to go back and relearn, the better. I think it was a blessing in disguise that Lindsey and I did all these reviews, because we definitely had to kind of keep a hold on what was going on in normal anatomy. So those of you that have done the AEP and PLG stuff, you're ahead of the game. Those of you that did good on the BSCE, you should have a good advantage going into this.
And I've had a couple people reach out to me asking, how do you keep up with stuff in year 1? It's incorporated into year 2. And so it's not like you have to go back and set, like when you get to step, it's like, oh, I haven't looked at year 1 stuff in forever. Well, it's incorporated into year 2. That's what I meant by, putting all the puzzle pieces together. It's there, it just keeps building. And year 2 just puts everything together. So don't really worry about losing stuff from year 1, because you have to bring it back into year 2.
Right. So yeah. So and for example, so like cardio and renal, you do a cardio and renal together module because it has a lot to do with blood volume and circulation and stuff. A lot of that, the pathology was new. You do cardiac hypertrophy, you do a lot of the renal glomerular diseases, diabetic nephropathy, stuff like that. But when we got to the GI stuff, a lot of the pathology we had touched on already. McCall's diverticulum, Hirschsprung's disease. So it really depends. Some modules tend to be harder than others. Some of the pathology you've touched on already, some of it's going to be brand new. So it just kind of comes and goes with the stuff. But some of the pharmacology is much more heavily tested, like cardiorenal, the CRS module, tons of pharmacology, just because you have all of the diuretics that you use for hypertension and blood volume. You have all the antiarrhythmics, all the heart failure drugs. So it gets really complicated quickly, but I think they do a good job kind of putting the pieces together throughout the different modules. Obviously, we will do the reviews for you guys. We'll post all kinds of extra stuff that we found helpful. But it's just kind of maintaining pace. So there's a delicate balance between being able to pace yourself, but also the better you do in the beginning, the less stress you will have towards the end. Okay, so I know that's much easier said than done, but like when you get to what is it? DERS.
DERS.
So,
I just said
DERS. Yeah. So
DERS.
It's a 6-week module of digestive, endocrine, reproductive, and you are as burnt out as you've ever been. And so the more buffer zone you have on whatever grade you want, the better you'll be. So this is how it breaks down. So the first module is it's 4 weeks.
Yeah,
I think it was 4 weeks. Yeah, FTCM. So it's fundamentals of clinical medicine. Yeah. So it's basically you go back through FTM, but when like you studied all those drugs for FTM and you're like, none of them showed up on the exam. Now they show up. Now you need to know like drug interactions. They'll put like 2 drugs together, like muscarinics with the diuretic, and they'll give you graphs and like antagonists and with organophosphate poisoning. And you have to look at reflexes. So all of that's going to come back. So all of the beta and adrenergic agonists and stuff like that, you'll redo that. So so it'll be a lot of.
But it makes more sense.
Yeah,
it really does make more sense.
So you'll quickly brush up on that material, and then you'll kind of get to more advanced stuff where you start looking at patient graphs and stuff like that, and look at their reflexive heart rates and stuff like that. Then you do CRS, that's 4 weeks of cardio and renal. That's brutal. So the cardio and renal, probably the renal more than the cardio, because there's a lot of imaging, the glomeruli and stuff that help to differentiate different things. They all kind of sound the same. Then you go on to respiratory and hematology go together. The difficult part about that is that a lot of the blood cancers, leukemia, lymphomas, the treatments for
Those run
that,
together. Oof, they
those
run
get
together.
difficult. Those sound a lot. And then, like I said, you close it out with a 6-week module of digestive, endocrine, reproductive. So it's the longest module you're going to have so far, and you're going to be tired. And then at the same time, you have to be prepping for the OSEX, where you're doing your SOAP notes and stuff. So do your best to pace yourself, but the better you could do in the beginning, the better off you'll be.
And I know you guys have this question, so full disclosure, I think every single one of our exams were curved.
No.
Yeah.
All of them?
Yeah.
Sorry, guys.
For term 4.
It's not my
That's
fault.
that's just representative of like our class.
Yeah, so I don't know, I don't remember, but so yeah, so as for outside questions, they do give you a lot of Sakai questions, but if I would have changed anything, at least for term 3, I would have just done some outside ethics questions just to see, because you can't go into it thinking it's very intuitive, because yeah, it depends.
I will say this, the way they tested in year 2 is very different from the way they tested in year 1, and you have to figure that out quickly to be successful. You will figure out what types of things within pharm, within micro, they like to focus on, but it is a little different. So just know that it is a beast. Term 3, term 4 is a beast. You do have to get used to, I mean, once it's set up the same way, like from one module to the other, it's set up exactly the same way. All of the pharm is set up the same way. The lectures, the path, it's incredibly organized, which I adore. And the micro is really organized, and so that kind of takes that stress away, that you really can just go through their flow. But just be prepared for that. It does kind of get it up a notch, but at the same time, you've gotten used to the endurance, you've gotten used to the exams, and so hopefully the learning curve isn't too steep, but just acknowledge it, that you will have to change some things up.
Yeah, they've recently redone all of the pathology notes. So they're very dense. It's almost like reading a textbook, but it's all there in the notes,
yeah,
everything you need.
The path lectures are incredible. And it's color coded too. So like if you have multiple different things, like the cardio path is like the theme will be one color, and then the one that we just got out of DERS, like the breast path ones were one color and the ovarian path ones were one color. And so I liked it because when I chunk the information, it flows very nicely and you know exactly what it is. And they'll tell you lecture 1 is this, lecture 2 is this. And like, it's organized very well. And so it takes away that stress so you can just focus on what you need to focus on. So I really appreciated that.
Lindsey, what is the Biostats Companion? Do we have a book for that? Or the Ethics Companion?
I don't know.
I obviously, whatever that you're referring to, show me. I don't know what that is.
Yeah.
Maybe
Sorry.
they gave you some extra books. If you can message me if you know exactly what it. I obviously didn't use it though. I found everything in the useful from the lectures. I didn't really go too far outside of lectures.
I would use osmosis sometimes. Because those are shorter videos, and so if I wanted to get a little better understanding, I would use that and annotate my notes. Additional step studying in term 4, no.
You are step studying by doing term 4.
Yeah.
I wouldn't worry about going outside.
If you guys have AMBOSS, or if you're thinking about AMBOSS, I started using that this term because you finally know enough information to answer those questions. Like I tried to do AMBOSS in term 2 and I couldn't, because you haven't been taught enough material to answer those questions. And so finally I was able to start using that. And I did an experiment where I did the AMBOSS questions after an exam that I took. And I was like, oh, this does match up really, really well. So if you have AMBOSS, you can use that as a resource. If you don't have AMBOSS and you're thinking about getting AMBOSS, I would endorse it. I used it, I pay for it. But that's one that I think when you get into year 2, you can start utilizing if you want to utilize a key bank.
And there's only one book you're required to buy for term 4. It's a pathology book. They'll email y'all about that. But I didn't use the book. I just use it to access the questions.
Yeah.
So you get access the questions on Inkling and use those. I did do all the questions for that though. So those were really helpful. Other than that, I mean, obviously as we go, we'll kind of, when we do our reviews, we'll touch on the more specifics, but yeah, just get through term 3. Yeah.
Just get through term 3. Just know that it's try to do your best. Term 4 is actually pretty enjoyable. It's hard, but it's enjoyable. I felt it was enjoyable, and I felt more like a med student than I did in year 1, honestly.
Yeah, clinical medicine.
Yeah,
sure.
because also the small groups felt very applicable. It felt very, I could incorporate it into what I was doing well. And even when you start doing the clinical stuff, it's incorporating what you're learning because you're using the pathologies that you're learning in your clinical skills. And so when you're doing those practice runs, when you're doing your mini exams, you're using the clinical pathology from your lecture notes. And so when you're mapping out, you know, what you're looking for when you're interviewing your patients, it's all from the notes. And so I felt that even though small groups there are a lot of them, I felt they were very helpful. They were very, very beneficial. You know, so definitely, if you're not one of those people that preps a lot, or this does really help you. It does.
Yeah, so the small groups are, hopefully you like your small group, first of all. Yeah.
Make sure that you guys work together.
Yeah,
honestly, like be nice, be professional, and work together. Because it does make it a lot. You're gonna see each other every single day. So get to be friends, get a really good working relationship. I know Brady and I weren't in the same group, but we both met with our groups and practiced patient cases leading up to the mini OSEX exams. And so, you know, we had a very good flow, we had a good rapport, and everybody knew what was expected of them. Everyone was on the same team. And so it made our small group experiences that much better because everyone was willing to do their part. So make sure you pull your weight in your small groups, because if you do, you're going to find that it helps you so much in term 3 and 4.
Yeah, like we said, you get to split up the pathology stuff. So you do your own slide, you present, everybody else presents. Pharmacology, there'll be cases. It'll help you understand the drug interactions, but they'll give you clinical scenarios that are relevant. Diabetic patient, kidney failure, what medications do you use, right? It shows up on the test. And then there's some micro small groups and stuff. So it's clinically applicable. So the idea that you are spending extra time sitting in class, at least you're can benefit from it for sure. Unless y'all have any other questions, I think that's it. I think just the biostats for me was a bit daunting. I don't, you know, it wasn't clinically relevant. So I focus on the style of questions that they ask in the IMCQs. Don't start writing down equations and start like solving for E equals MC squared or anything. All right. You don't need to know that. You just need to know theoretical problems. If a patient presents with this, if you did a research project with this, do it that way. So y'all should be good. Good luck. Pace yourself.
Yeah.
Amazing.
It's a long term. Just in all honesty, it's long, it's exhausting. You guys are going to be in school though when everybody else is at the end of term 4. So with us, it was hard because the end of our term 4, everyone was ending. And so we're already tired and everybody else is done and on vacation. And so I would expect that ending term 4 burnt out, but you see everyone else studying around you would help a little bit.
Yeah, and we'll be here for you guys. We'll do our
Yeah.
reviews as we go. Just a quick side note for IEA, anybody that's going to apply, the application won't be till August when everybody else starts. Okay, so nothing now. You can submit your dean's letter when we get to August, and we'll deal with that later.
Yeah.
Other than
For
that,
those of you that are going to be on the island, we'll see you there. We'll meet up
at the
and hang
bar.
out. For those of you that are remaining online, we are still going to be there for you. We are still going to support you. You are still our family.
But we're going to have much better tans in the process. So don't worry about it.
We'll have reviews on Grand Anne's Beach. Oh my goodness, that would be so funny.
All right, I'm going to stop the recording. This will be posted for you guys later. We love y'all. Bye-bye.
Yeah.